You know that there are many medications that can predispose you to develop insulin resistance, and thereby I'm going to share to you what maybe other doctors will not tell you. Number one, corticosteroids, very common. They usually give this to you when you have some allergic reaction, number one. Or number two, when you have some breathing difficulty. They give you this Medrol pack that you do decreasing dose for certain days. Be careful with this. Number one, this can increase your sugar. It increases liver glucose production. It reduces glucose uptake in the muscle and promote fat redistribution. So what does it mean? You can develop visceral fat, obesity, or your waistline will increase. Second, it will also weaken your muscle and also weaken your ligaments and your bones. So it is a very strong correlation, dose-dependent insulin resistance with steroids. So resist getting steroid. Antipsychotics, especially the atypical, we're talking about Olanzapine, Clozapine, or Quietiapine. The weight gain is very well known for these medications. There's a direct interference with insulin signaling and appetite stimulation. You develop voracious appetite, especially for sugar and salt. This is the most, among the highest risk drug classes that would develop insulin resistance. Third, the innocent thiazide diuretics, or is marketed as hydrochlorothiazide or HCTZ. This is usually given for patients with high blood pressure, and also chlorthalidone. What it does is it depletes potassium and impairs insulin secretion. Thus, there's no insulin secretion. It reduces insulin sense and also diabetes. HCTZ or hydrochlorothiazide. Fourth, a very common drug for high blood pressure, which is a very weak antihypertensive to lower the blood pressure, and also is given for, paradoxically, for patients with coronary artery disease or heart attack or prevention of heart attack, or even irregularity in rhythm. These are the medications called the beta-blockers, atenolol, for example, and metoprolol. You see this all the time. Look at your medicine cabinet. It will mask hypoglycemic symptoms. That's why your blood sugar can get low, but you might not know it because the beta-blockers are there. And for all you know, you can develop coma if you are not monitoring your blood sugar. It can also promote weight gain. So have you ever wondered why you want to decrease weight? Because you want to avoid metabolic syndrome also. What about the good old statin drugs to prevent cholesterol? Isn't it something? It is mild but a real effect. Examples are Atorvastatin or Lipitor, or Simvastatin. The mechanism is that it has a slight impairment in insulin sensitivity. It has a possible effect on the pancreatic beta cells to impair release of insulin. However, it has an important benefit for the disease. Usually, the effect or the side effect of statin outweighs the benefits, especially when you have a history of heart disease, because the statin has a pleiotropic effect, especially oral contraceptives. The ethinyl estradiol combinations. These are the synthetic hormone replacement. For men, it's the androgens, the anabolic steroid, testosterone, especially in high doses. This can actually increase your propensity for having insulin resistance and eventually diabetes. The mechanism is it alters fat distribution. It affects insulin signaling pathways. So be careful with those medications. It's not just an aesthetic medication or something that you can just use without having to fear of side effects. Number 7 are the group of immunosuppressants. Are the ones that produces insulin. It reduces insulin secretion. So it's very common in transplant patients. Number 8, antidepressants. Some of them. Examples, paroxetine or Paxil, and Amitriptyline or Elevil. It's correlated to weight gain. It changes appetite and metabolism. So it takes both mechanisms, Paxil or paroxetine and Amitriptyline. Other notable drugs are number 1, niacin, which usually is used for decreasing triglyceride. It raises glucose, and it's a protease inhibitors, which is a strong metabolic effect. So the key concept here is that most of these drugs disrupt insulin signaling or increase visceral fat, which is the most dangerous fat because this is more active to promote cardiovascular disease. Both lead to reduced glucose uptake and higher glucose level in your serum. The important aspect is this, that not everyone develops insulin resistance if you use this kind of medication. The risk depends on the dose, the duration, your genetic predisposition to develop insulin resistance, and of course, what counteracts our good friend lifestyle, avoiding sugar, exercise, meditation, and taking care of stress. These are all related. However, be careful. These medications, although beneficial, can have some risks in terms of your health, raising or increasing your insulin resistance, and somehow develop diabetes and even visceral fat obesity, which therefore would be a case for metabolic syndrome. If you like this topic, please share, subscribe to the channel for more talk about related to medicine and faith. Thank you very much.